In this video, we're going to take a look at the discharge instructions, readmission, and mortality dashboard. Beginning in the upper left-hand corner, we can see a map of the United States, and each of the states are identified in a different shade of blue. Now, the states with a darker shade of blue represent states that have a higher patient satisfaction rate with doctor communication. Compared to those states with lighter shades of blue, they're reporting a lower rate of patient satisfaction of doctor communication. So if we put your mouse over any one of these states, let's say Ohio, we can see the state of Ohio has a median reported satisfaction rate of doctor's communication at 78%. Now, off to the right here, we can see all the counties in the United States, and this is showing patient satisfaction with doctor communication rates in descending order, with those counties with the highest patient satisfaction rates at the top, and scrolling down, we can see those counties with lower patient satisfaction rates. Now you'll note that each of the counties is identified in a different color, and that color coding is over here, and that's representing the population types. So those counties in blue are metro counties, and they have populations of 50,000 or more. Those counties in orange are non-metro cities, and they have populations between 2,500 but less than 50,000. And non-metro towns are identified in red, and those are counties of populations that have less than 2,500 people. Now there are a couple counties that are not classified, and those are identified in gray as unavailable. Now, in addition to the discharge instruction satisfaction rate, we also have other health outcome measures, and you can see those right here. So these are a list of the common health outcome measures and the median rate. And again, this is for all counties across the United States. Now we can take a look at those health outcome measures as well and compare them to communication rate or the rate that patients were given information about recovery. So we can look at the correlation between that communication rate or information about recovery rate and the health outcome measures. Now the health outcome measures are all identified in different colors, and those colors are corresponding to the color that you see here. So now we can modify this dashboard to be able to look at specific data. First, we can modify by state. So let's say we want to take a look at just the state of Wisconsin. Click on Wisconsin on our map, and what that will do is update the entire dashboard to show only data that's coming from the state of Wisconsin. So we can see the counties listed that are from Wisconsin in descending order of patient satisfaction rate, and then we can look at the health outcome measures just for the state of Wisconsin. Now if we click on Wisconsin again, that will bring back, refresh the dashboard with all 50 states again. And then what we can do is we can select a different filter. Here we can look at population types. So let's say we wanted to take a look at only non-metro cities. So if we click on non-metro cities, the dashboard will refresh and will show only non-metro city data. So this is data from counties that are identified as non-metro city counties. And we can then go back and select all, and that will refresh the dashboard back to include all the data. But now we can also take a look at filter our data down here by specific health outcome measures. So if we want to take a look at just death rate for heart failure patients, we can select that. And that's going to, and we can select other outcome measures as well, but this will just show that one rate, and will show just that one measure for communication rate and patient given information about recovery. So we can look at the outcomes just for that health outcome measure. Click on all again, and that will repopulate the data to include all health outcome measures. So you are able to select one, but you're also able to select multiple health outcome measures. So this is the dashboard for discharge instructions, readmission, and mortality rates.